Yes, so hello everyone. I just thought I quickly go through instrument and just also go through your surgical notes after you have used this instrument. I saw in the last exam that some of us are still struggling. So we'll go quickly through it. Firstly, we know that we have a valve on top here, and then we have a plunger syringe system on the other side. So the cap, we already talked about how to remove it. You press on the latches there, then you just pick it up like that. So what you see, what I have in with me in my hands here is a valve cap. Yeah, so that's the first thing. Then it's easy to disconnect the syringe plunger system from the valve. We all know how to do that. So you just disconnect like that. There's nothing that you need to do there. Then you have the valve here, which we've already removed the cap. So we press on the latches, which are on the sides. We lift up the cap. Then the next bit is that we have this thing here. You just use it to open. So you just open the valve like that. So inside the valve you have this soft rubbery part which we call the valve liner because it's lining the valve. So that's about the valve, really, nothing else. Then you come to this instrument here. You have your plunger, but the plunger doesn't come out just like that. You have to remove the collar or the stopper. Some of you call it the stopper, which I kind of accept, but yeah. So you remove the collar from there like that, and then yeah, this is a collar. It prevents the plunger from easily coming out, so that blood doesn't splash on your face when you are done with the instruments and you are dismantling it, or when you are doing the procedure, you want to create a vacuum, it doesn't easily come out. So that's the collar. This is the collar over here. Then this is the plunger, and this is a syringe. So we have a syringe here which we can put on the side. Then we come to the plunger. Again, we've already discussed how to remove the ring. This is a ring, the plunger ring, or the plunger O-ring. You can call it a plunger ring, that's fine. So this is a plunger O-ring that we remove from the plunger using a simple technique. You press and push on the ring. You press and push using your index finger and your thumb, and then you just lift it up on the other side with the index finger and the thumb. Yeah, so that's how that works. So this is your ring, the plunger ring or the plunger O-ring. Everything there is acceptable, and then you have a plunger here. The last part is that this syringe has 60 mils capacity. So when you're evacuating the uterus, you have the opportunity to just count how many of these, how much volume you evacuated using these graduations that are there. So this is a 60 ml syringe. So when you're evacuating the uterus, you kind of keep measuring how much you are evacuating so that at the end you add it up. Or if you have somewhere to measure, you can just measure everything that you have evacuated. So that's about the instrument. The last bit about this video is just really how you properly write your notes after evacuating the uterus. So you have to write down, of course, you write down the date, the time you did the procedure. You have to write down the surgeon, like who was in charge when you're doing the procedure, who was the assistant during the procedure if you had one, and if there was a nurse assisting, you also have to write that down. So the personnel involved in doing the procedure have to be written down. Then you have to write down your surgical preliminaries. What did you use to kind of like disinfect the patient? What did you use? Did you use Savlon? Did you use iodine? You have to write all those down, the areas that you used iodine in, and so on. The technique for disinfection, the vulva, the inside of the vagina. Did you clean with iodine or Savlon, whatever you used to disinfect the patient? So you have to do those preliminaries. Then you have to write down what kind of analgesia that you gave the patient. Was this procedure under Verboten kind of cooperation, you talking to the patient, communicating with her, or did you do a cervical block, or did you give some diazepam and pethidine during the procedure? Usually what I find is that with this procedure, if you partially sedate the patient, you struggle a bit because they'll be moving about and they can't really get you when you say cooperate. So normally you need to just do complete analgesia. Don't sedate the patient partially. So you need to write what you used for analgesia. Then where did you put the tenaculum during the procedure? Because when we are doing the procedure, you have to put the tenaculum there, have support as you move in and out with the vacuum aspirator. So you need some support. So usually you use the tenaculum. So you have to indicate at what part of the cervix you had put that tenaculum. Even with if you had used cervical block, where did you put that lignocaine? At what parts of the cervix? Did you put it at 9 o'clock? Did you put it at 3 o'clock? You need to indicate exactly where you injected that anesthetic. Then the other thing, so you've done your analgesia, then you start evacuating. So you need to indicate in your notes how much you evacuated from the uterus. So did you evacuate 120 mils of products of conception? Did you evacuate 140 mils? Did you evacuate 200? Did you evacuate 300? That is important because sometimes ectopic pregnancies are missed. Somebody comes with vaginal bleeding. Somebody thinks it's an incomplete abortion. They do an MVA. But when they don't evacuate much and they don't indicate. So when you evacuate very little, it might indicate that maybe all products of conception had already come out. It's a complete abortion, or that it's another diagnosis. It's not an abortion because you've said it's an incomplete and there's not much that has been evacuated from the uterus. So you need to indicate that. You also need to indicate the total blood loss that was there during the procedure. So blood loss is very important. Was it 100? Was it 200? Was it 300? Usually the blood loss is much higher when you have a bigger pregnancy compared to a smaller pregnancy. So basically those are the important aspects of your surgical notes. And of course there are some surgical orders that you do after the procedure is finished. You put the patient on antibiotics, you plan for your contraception, you explain to them the danger signs, that's bleeding, fever, unusual abdominal pain. All those can show that there's some complications after the procedure. So you have to counsel the patient about all those things about the instrument. So that's part of the things that are in the notes. So after the procedure, of course, you have to monitor the blood pressure, you have to monitor the pulse, you have to monitor the PV bleeding, do a pad count, just to make sure that the patient is stable after the procedure. So we just wanted to talk about two things about this instrument, a reminder about the parts, which I saw that people are still struggling with. Then the second bit about the surgical notes, what you have to write as part of your surgical notes. So thank you for listening, and see you in the next one.